Now, the Moderna vaccine's approval for the younger age group will eventually be another tool to reach groups yet to be vaccinated.
Madeline O'Neill breaks down how it will help as efforts toward herd immunity continue.
Well, when looking at who still needs the vaccine at this point, it's really down to people who face some barriers, have some hesitancy, and children. Community clinics, like one held at the Urban League in partnership with SSM Health today, aim to get to all of those groups. And that's a priority of the state, as well as Governor Tony Evers, who stopped by today as well.
Piece of cake. All done.
We all have our reasons.
I decided to do this today so I can see my parents. Good for you.
To get vaccinated.
And it's about time. I haven't seen them for 14 months.
There are reasons 53% of people in Wisconsin haven't gotten their vaccine yet, too.
It's pretty painless and it's pretty quick.
Brandon Jones is part of Sable Flames, a group of black firefighters in Dane County, volunteering to give the shots at this clinic at the Urban League, geared toward communities of color.
There's a lot of distrust in the healthcare with that, and so we're here to kind of bridge that and rebuild that trust.
Building trust and bridges over barriers such as lack of transportation.
People can walk, right here and get the vaccination.
Now, for some children and teenagers, age no longer stands in the way of getting a vaccine.
We're not going to achieve herd immunity without vaccinating a good significant portion of our children.
About 15% of 12 to 15-year-olds statewide have gotten the vaccine, 41.4% in Dane County.
These pop-up clinics are doing a wonderful job of bringing the vaccines out to the communities where the people just have to walk down the street to get them. And that, I think, is a real game changer in terms of getting the children vaccinated.
UW Health's Dr. Bill Hartman says the Moderna vaccine's likely approval for ages 12 to 17 will make a difference, too.
Having a second vaccine will allow us to get closer to herd immunity faster.
Thank you.
Something Jones has good reason to say can't come quickly enough.
As a first responder who's been working in this pandemic since its inception, it is a dire need that we get that herd immunity so we can move on with life.
Today's clinic was partly funded by a grant from the Department of Health Services for community outreach. And DHS is extending those outreach efforts to pediatricians and schools as well to help get kids vaccinated.